Dr. Jim Blanton is here from Blanton Chiropractic Neuropathy with his patient Susie Keller to talk about treating pain in your feet. You brought the model here because I think when our feet hurt, we really do hurt all over.
It's the worst because we always say in the office, your upper body can be really healthy, but if your wheels aren't working right, then you've got a real problem. So.
Yes, that's so true. So, Susie, talk about your situation, because you were telling me before we went on, you were a school teacher for many years. So we all know teachers are standing on their feet on those hard floors for a long time.
Susan, it was important to me because this was not a all-at-once thing that happened. It was a gradual thing. And like many teachers, we put everyone else ahead of ourselves.
You do.
And it took me a while chasing the pain and foot doctors and trying to cure myself to get to this point. So after I decided it was time for me to take care of me, I stumbled upon WSAZ and Dr. Blanton.
Oh, well, we're glad you did. So were you having trouble even just doing your normal walking and your job?
I could do my job. It got a little more difficult as the time went along. I would use my chair to wheel around to work with the kids at the end of the day. I'd be okay. But, you know, the end of the day, I was spent. That was it. And it was to the point where I wasn't enjoying anything else but having time to go to work.
That's not living, really, you know.
No, it's awful.
Yeah.
I couldn't garden. I couldn't climb a ladder. You know, I'm a pretty active person, but it was like a gradual decrease in the activities that I could participate in any length of time.
Right. Okay. So you heard about Dr. Blanton. You came in. What did you start doing to help her?
Well, the first thing we do is the number one most important thing out of that first visit is to find out if we can help you or not. So, so many people have been told that there's nothing can be done. So we do a full exam. We do thermal testing on the feet. We do neurological testing to see what people can feel or not feel. And so we've got to catch it before it gets too far gone. But, you know, a lot of people have been told that there's nothing can be done for this.
Right.
But if we catch it early enough, we can really make some miraculous changes in those feet to give people their life back.
Oh my goodness,
we always say it's really sad to be like Susie and work for, how long did you?
25 years.
25 years, be a teacher, and then you get to the point where you should be able to retire and enjoy the rest of your life, and you can't because you can't even go to Kroger or Walmart or the mall or anything like that because your feet are hurting so bad, or you can't sleep because they're burning, and you can't even put the sheets on your feet.
Well, we saw a thermal scan there. Was that of Susie? And what are we looking at when we see that?
What we're looking for, those thermal scans should be red or white all the way down. And when they start turning yellow, like that one, about halfway down the shin bone, and then when you see that, when we get to the toes, they're turning blue and green. It means that those little tiny blood vessels, not the big vessels like the femoral artery, the little tiny blood vessels are the capillary beds. And those capillaries have to bring oxygen to the cells. And it usually starts in the toes because it's the furthest away from the heart.
So what kind of things have you been doing over the past, I guess, when you began treatment with Susie, and how does her scan look like now if we were looking at one?
It was really amazing to know that the alternative therapies that he's using made such a significant change quickly. The infrared, the supplementals, the laser lights, and all of these things that help you to immediately feel a difference.
And did you feel a difference?
I felt a difference, and that's why I decided to continue with the therapy. Always go in as a skeptic, as anything that's not necessary. But at this point, it was necessary for me to have faith in someone else. Instead of just taking medication. The medication just masked the pain. And he told me, he goes, if I can help you, I will help you. If I can't, I will let you know right up front. And that was the most important thing that changed for me, that I did start feeling things immediately. Investing that time into the therapies in the office, but also there's homework to do at home. And it's the supplementals have helped increase the blood flow to the nerves. And taking that time for yourself, it's kind of reflective that you understand that you can heal yourself if you're willing to put in the time and effort and to find someone that you can trust.
Yeah, feeling great today now?
Absolutely.
Oh, that's wonderful.
Yeah.
We have some information on the screen, Dr. Blanton. Tell us about it.
So the girls, of course, they're at the office. They're waiting on your calls right now. And like we always say, just because you've been told that there's nothing can be done for this doesn't make it true. So don't put it off. And like we always say, Susan, procrastination is a thief of health. We're here to give you hope so that we can maybe change your life from this point forward. So
yeah, get you back to life.
Get you back to living.
Yeah.
Susie, great meeting you. And Dr. Blanton,
Nice to
thanks
meet you.
for stopping by today.
Thank you.
You're welcome.
All right.